New York is heading toward phase 4 of their reopening plans, but many other states are putting restrictions back in place as they see surging coronavirus case numbers. Dr. Robert Hariri is the founder and CEO of Celularity, a spinoff of biotech giant Celgene, which developed the first cell therapy approved by the FDA for clinical testing in the coronavirus fight. Dr. Hariri joins me now. Doctor, thanks so much for being with us this evening. I'd like to start with the question that a great many Americans have on their minds right now, and that is there justification for kids to go back to school? What are the risks and what are the benefits?
So, Judge, first, thanks for having me. One of the most crucial questions you have to ask at the outset of an infectious disease like the new coronavirus is how deadly is this new disease? And in the case of coronavirus, the first information we got from China was terrifying. If you remember, early on, we thought that this might be a virus that could have a lethality of 5 or 10%. That means somebody is going to die from this disease. Now, fortunately, the data has indicated that although this is a bad virus, no doubt about it, it is ruthlessly lethal against the elderly and the infirmed, but it is sparing the younger population. And in fact, kids, for the most part, will do very, very well. In many cases, won't even experience any symptoms if infected. And if they do experience symptoms, they tend to be very mild. So that is something which is heartening when we're thinking about having our kids return to the classroom.
So why is there so much pushback by the teachers' unions, saying that it's really not safe? Is it more safe for kids to be in school or at home? And that's separate and apart from the COVID issue. So let's do the accident. Go ahead.
All right. So what we know is this. We know that that COVID-19 is extremely limited in its lethality for children. In fact, on the list of the 10 most common causes of death in the 5 to 24-year-old population, COVID doesn't even make the top 50. What in fact is true is that a child from 5 to 24 is about 88 times more likely to die of an accidental injury rather than a COVID infection. And in fact, from 5 to 14, children are 5 times more likely to die of influenza, the seasonal flu, than COVID. So although the teachers union is quite concerned that children might become infected at school, perhaps transmit the disease back to their household, nothing is preventing that from happening, even if they're existing among their peers, their parents, and so on. And teachers can take steps to protect themselves in the classroom. They can use isolation shields and all the social distancing tools we have in effect right now. But the specific risk to children 5 to 24 is extremely low.
All right. I don't have a lot of time, Doctor, but I want to ask you this. If you were to use the CDC's lethality rate in assessing the percentage of COVID deaths, right now the Johns Hopkins is saying 3.9%. What say you?
So interestingly, the way you calculate what they call the infection fatality rate is by dividing the number of deaths by the denominator, which is the number of people who've been infected. Now, we simply don't know. We can't measure everyone to know who's been infected. But if you use the same tools and the same approach that the CDC uses for influenza, where they estimate the total number of people who get infected during a season, and then use that as the denominator, we're looking at an infectious fatality rate that is slightly above what's seen for seasonal flu. Now, the numbers aren't out yet, but if you remember at the beginning of this crisis, there was concern that this might be 5 or 10 times more lethal. And we just don't think that's the case right now.
What do you think it is, very quickly?
I think it's probably 2 or 3 times, and some estimate that as high as 0.5% versus 0.1% for influenza. But either way, it's not nearly as bad as what was predicted.
All right. Dr. Robert Hariri, thanks so much for being with us. And John Solomon is next.